This is Forum Daily's Week in Review. I'm Nathaniel Dewick. Budget 2022 was introduced last week and set out the federal government's spending priorities. Among other things, the federal government highlighted mental health. Budget 2022 proposes providing $140 million over 2 years to Health Canada for the Wellness Together Canada portal, while providing continued support from the previous budget. It also pledges $100 million over 3 years for addiction support. With us to discuss how the budget addressed mental health in Canada is Sarah Kennel, National Director of Policy at the Canadian Mental Health Association. Ms. Kennel, how are you?
Good, thank you. How are you?
Great. Thank you for being here. Let's take a look, big picture. How did Budget 2022 address mental health needs in Canada?
Well, taking stock of the budget in its entirety, as you mentioned, we saw investments in the Wellness Together and Pocket Well app, so a virtual mental health providing service that's being offered to Canadians across the country. We also saw increased investment in the Health Canada Substance Use and Addiction Program and some other initiatives that seek to address populations that have been disproportionately impacted by the pandemic from a mental health perspective. All good things. However, what we didn't see is a rollout plan for the promised Canada mental health transfer, and that, in our opinion, is a missed opportunity.
Well, it's interesting. There are missed opportunities in every budget, it seems. Along with the COVID-19 pandemic, communities across the country have been reeling from opioid-related overdoses and deaths. So I know it was mentioned in the budget there was a special line on opioids. How does it address addictions and addictions needs in Canada?
Yeah, well, what we know is that community-based interventions to address problematic substance use and the opioid crisis are really critically needed. And there's an opportunity in this budget through the Substance Use and Addiction Program to scale up those types of interventions. So we're really happy to see that. At the same time, we do need to see greater federal leadership, when it comes to safe supply, safe consumption, and those conversations have yet to really take off. And that's where we need to see investment and political commitment.
Interesting. Now, CMHA's recent study, we've got the title here, Running on Empty, How Community Mental Health Organizations Have Fared on the Front Lines of COVID-19, indicates that community-based mental health addiction services are key to the system. So does the budget address the funding needs at the community level with what you're seeing?
Not nearly enough. What we're seeing really is a rehash of what we've always done, which is fund the public sector, hospitals, psychiatrists, family physicians. We know these are critical components of the mental health system in Canada, but they're not everything. And we know that a lot of people rely on private insurance and paying out of pocket to access services like counseling and psychotherapy. That's where we need to see greater attention paid and increased investment. And until we do that, people are going to experience barriers and access to mental health.
So speaking of the front lines, what about the frontline workers themselves? Does the budget offer any support for these workers, especially as these services have been in such high demand during the pandemic?
Yeah, what we know about community mental health workers is that they're overburdened, they're burnt out, and really they're facing great pay disparity when it comes to the salaries they receive in comparison to their counterparts in hospitals or, the public health system more generally. And so while investments in Budget 2022, like the Foreign Credential Recognition Program and loan forgiveness for doctors and nurses working in rural and remote areas, are incredibly welcome. They aren't, the full picture in terms of the type of investment we need to see. We need to see dedicated attention put towards pay equity and also strategies to reduce the burden placed on the community mental health workforce that has just been tapped out during the pandemic.
And we know, not only workers, but people across the country have really been seeing a lot of, mental health related strain, and that, I believe, a survey with UBC that you did, CMHA as well, 37% of Canadians say that they are struggling with mental health. Where are they going? Where are Canadians going? Where are individuals turning to for support?
Well, we know that through this research, about 10% of the population has turned and relied on virtual mental health services like Wellness Together or a CMHA program called Bounce Back. These are incredibly useful for people experiencing mild to moderate symptoms of stress, anxiety, and depression. However, it isn't going to work for everyone. We know that people with more severe mental illness are going to require in-person care. We know that those seeking care, about 20% of Canadians said that they just weren't able to get the care that they needed during the pandemic, and that's really concerning. And among those who couldn't get care, 30% of them cited not being able to afford the care because they couldn't pay out of pocket to get it. So the research is significant, and the numbers are getting worse.
Wow, incredible. Very important conversation, lots to keep in mind. Well, some residents of Shanghai have been allowed out of their homes as the city of 25 million eases a 2-week shutdown. This comes after a video posted online showed what was said to be people who ran out of food breaking into a supermarket. The online news outlet, The Paper, said about 6.6 million people will be allowed to go outdoors. The government said some markets and pharmacies would reopen. However, a health official warned that Shanghai doesn't have the virus under control despite easing restrictions. China's zero-COVID policy is among the strictest approaches to dealing with the pandemic in the world. Well, with us to discuss China's zero-COVID policy is Dr. Charles Burton, an expert on China affairs. Dr. Burton, welcome to Forum Daily.
It's good to speak with you.
So firstly, let's begin with this. What is China's zero-COVID approach?
Well, essentially, if there is even a single case, whether it's symptomatic or asymptomatic, the person and their contacts are isolated. And this is not quarantine requiring that you stay home, but people are sent to specific, specially constructed quarantine facilities until such time as the risk of transmission is removed. And so we've seen in the earlier phases, some fairly frightening stuff of children who have tested positive being removed to hospital facilities away from their parents. They seem to have eased down on that policy a bit. But in general, anyone who has any form of positive test is isolated. And, recently, Shanghai has been maintaining, essentially imprisoning most of the 26 million people in Shanghai in their apartments. Initially, it was for a 4-day period, and then expanded. And as your report indicated, people started to run short of food. The services for delivering food were inefficient, and any number of other serious issues with being essentially locked into your apartment, such as people who had prescription medicines were not able to renew the prescriptions, and people whose close family members had become near death or died while in isolation were not able to go and see them and attend to their final rites. So it's been a very troubling situation in Shanghai, causing a great deal of public discontent. And in addition, it's causing a ripple effect in other cities in China, as they are afraid that the central government will impose the same extremely restrictive policies. You're seeing panic buying all over the country.
You mentioned panic buying in addition to the human cost of this. So what are the economic repercussions that are resulting from this policy, in particular in China?
Well, I mean, it has had an enormously disruptive effect on supply chains because so many people are unable to get to work. And so we're expecting to see a decline in Chinese GDP as a result of this. And, Shanghai is China's economic center, and there's a lot of industrial activity that goes on there. So closing down the city of 26 million has a huge impact on the Chinese economy and exports as well. And I don't see any end to this, largely because the Chinese vaccines are not as effective as our vaccines. They haven't developed the mRNA vaccines. And the Chinese government, I think out of nationalist pride, even though they could well afford to do so, have not been importing the more effective vaccines. So this policy is partially a function of the ineffectiveness of the Chinese vaccines.
So you mentioned an ineffective approach here, but why are officials in China sticking with the zero-COVID approach?
Well, it becomes very difficult to turn it around once it's got the approval of the senior leader, Party General Secretary Xi Jinping, and because of the lack of medical facilities in Shanghai to deal with large numbers of people needing ICU care. this policy seems to be their best option. In other words, just not allowing people to contact each other. But with the very virulent strains of COVID that we're seeing now, it's becoming harder and harder for even these extremely restrictive policies to tame the disease. So even though you only have in a city of 26 million reported something like, 1,000 cases that are symptomatic and 25,000 or so a day that are non-symptomatic, they're still worried about it spreading like wildfire and causing, massive tragedy and death in the city. Aside from which, their vaccination rate in the senior community has been very low, largely because Chinese people, because of traditional Chinese medical beliefs, are resistant to vaccination.
Well, that is very interesting. Thank you for joining us today, Dr. Burton.
It's good to speak with you.
Thank you very much. Prince Charles and his wife Camilla are going to make a 3-day trip to Canada next month that will see them visit Newfoundland and Labrador, the Northwest Territories, and the Ottawa region. This will be the 19th time the heir to the throne has visited Canada. Governor-General Mary Simon says the trip during the Queen's Platinum Jubilee year will give Canada a chance to showcase its diverse and inclusive society and the resilience of Indigenous communities. Joining us now to discuss the royal visit and the place of the Crown in Canada is Dr. Michael Jackson, President of the Institute for the Study of the Crown in Canada. Sir, welcome to Forum Daily.
Great to be here.
So what do we know about this visit so far?
Well, what we know is that the Prince of Wales and the Duchess of Cornwall, that's Prince Charles and Camilla, are coming to Canada in May for 3 days to celebrate the Queen's Platinum Jubilee, her 70th year on the throne, which is a very historic and record-breaking anniversary, as you can imagine. What we also know is they're only going to 3 places in those 3 days: Newfoundland and Labrador, the National Capital Region, and the Northwest Territories.
Yes, and as you mentioned, it comes during the Platinum Jubilee year. What is the significance of the Platinum Jubilee?
The Platinum Jubilee is absolutely a remarkable and historic occasion for all the Queen's realms, and that sure includes Canada. If you look at what Canada is now and the monarchs that reigned over us, the only one that has reigned longer than Queen Elizabeth II is Louis XIV of France. 72 years in the 17th and 18th centuries. And the way the Queen's going, she's going to break that record.
That's it's always interesting. The King Louis of France. Who would have thought that far back? But appreciate it. So the Governor General says the tour will allow Indigenous communities to showcase their resilience. So let's take a step back here. And what is the relationship between the Crown and Indigenous peoples in Canada?
Going back even to the 17th century France, the First Nations, Indigenous peoples in Canada, when the European settlers came, like from which I'm descended, they made treaties and agreements with the monarch of the day. So we start out with Louis XIV in France and his successors in the 18th century. And then when the British arrived, the treaties were made with King George III, was issued a royal proclamation in 1763, guaranteeing that the lands on which the Indigenous peoples dwelt were their lands, and they could only be occupied by settlers under treaty and agreement with them. And then the Treaty of Niagara 2 years later in 1785 confirmed that for the First Nations of that area. And since then, we have a series of treaties which are with the monarchs, starting with Queen Victoria and now recognized through Queen Elizabeth II as Queen of Canada.
So the Crown in Canada is not just the person of Queen Elizabeth II, but is also the top of the legal and political system in this across the country. So how central has the Crown been to making Canada what it is today?
The Crown is absolutely central in our Canadian identity. We are a constitutional monarchy. We've been a monarchy of some kind for 500 years. Previous, there were Indigenous forms of government, of course, but the Indigenous people have taken a particular close relationship with the monarch and the Crown because it's a people-to-people relationship. It's a kinship relationship. And in our system of government, the Crown is kind of the pinnacle, as it was. It represents the 3 constituent parts: legislative, executive, and judicial. The monarch symbolically is the head of it all. And her constitutional guarantees underpin our system of democratic government in Canada.
It's not just democratic life, but as well as government officials also swear an oath to the Queen. Can you tell us a little bit about that and its importance as well to governance in Canada?
That's right. I was an officer in the Army Reserve years ago, and we swore allegiance to the Queen. We don't swear allegiance to a political party or a government, not even to a flag, not even to a constitution. We swear allegiance to a sovereign who embodies all that and is totally nonpartisan and removed from the fray. It's an ideal, it's a symbol, and a very powerful one.
Indeed. So for viewers who may be wanting to learn more, where can they go to learn or read up about the Crown in Canada?
The Department of Canadian Heritage has an excellent website under the Government of Canada website, and I would commend that very much, particularly in this Platinum Jubilee. Canadian Heritage and the Office of the Governor General have produced a really spectacular Platinum Jubilee emblem, and they've made lapel pins available with that and flags. So that's a good source. Our own institute, we've done a series of backgrounders on the Crown to make it accessible to the ordinary citizen. And if you Google us, the Institute for the Study of the Crown in Canada, find our website, you'll get it there.
Fantastic. Well, Dr. Michael Jackson, President of the Institute for the Study of the Crown in Canada, thank you.
It's a pleasure.
Afghan interpreters who have made it to Canada say they want the same treatment for family members fleeing the Taliban as Ukrainians escaping from Russian troops. They're accusing Immigration Minister Sean Fraser of breaking a promise to bring their families to Canada starting this year. Afghan interpreters told MPs on a parliamentary committee Monday that none of their families have yet arrived under a special program set up by the federal government. This, despite a promise from Mr. Fraser that some would arrive by this month. They say their families should be allowed into Canada as easily as Ukrainians, who face a lot less paperwork and security checks. They say the Taliban is punishing the families of Afghan interpreters. Their families are burning documents showing links to Canada and are fleeing house to house in fear for their lives. Well, with us to discuss the current situation for the Afghans is Omar Samad, Afghanistan's former ambassador to Canada. Sir, welcome to Forum Daily.
Thank you.
So the big question I think many viewers have is why have no family members of these Afghan interpreters been able to arrive in Canada?
Well, that's a big question, and it's multifaceted, meaning that there may be some reasons in Canada, and there may be some reasons in Afghanistan where the families seem to be stranded. And there may be some issues along the way with the hubs, the vetting hubs that some countries are using to evacuate some of these individuals. On the Afghan side, I think that you have a choice. Either you play hardball with the Taliban and they make it difficult for people to leave, or in some cases, as we have seen with other countries, you engage with them knowing that this is the purpose and that they need to respond and hopefully positively allow the family members who legally can travel and leave and join their families and their loved ones in Canada to do so.
I know the federal government says it set up a special program to bring interpreters' families to Canada. Can you explain that program to our viewers?
Well, I'm not in Canada, and so I have followed the story somewhat closely, but I think this is a question you may ask of Canadian officials. They should be able to give you more details. As an ex-Afghan diplomat, I don't have the details of what this special program is, but we do know that this program, the intent is to bring to rejoin families, make sure that they can, and immediate families, we're talking about immediate families, as well as people who have and used to work for the Canadians way back when Canada was in Afghanistan. So this is obviously a program that is designed to do so, and I'm not sure how different it is from the Ukrainian program.
Interesting you mentioned the Ukraine program. This is certainly contrasting the two humanitarian crises quite accurately. But what are some of the reasons that family members in Afghanistan could face more paperwork and security checks than those who are fleeing Ukraine?
Well, there are two very different cases. Obviously, Afghanistan, a country that has been at war for 20 years, part civil war, part a war against terrorism, in part insurgency, counterinsurgency, a very complex situation in Afghanistan where you sometimes don't know who's who and whether they're friend or foe. And so obviously, anyone getting out of Afghanistan has to, even if you know them, even if they used to work for the US or Canada or a European country or anybody else, you still need to vet and you still need to make sure that they are safe and secure individuals and that they do have a valid reason to leave. So I think that in the Ukraine situation, which is ongoing, things are much more black and white. They're much clearer. You have the two sides. It's a new conflict. And it doesn't seem as complex as the Afghan war that lasted for 20 years.
Well, just a quick 15 to 20 seconds left here, but how can viewers engage here in Canada to help get the family members of these Afghan veterans to the country?
Well, it's a great question. I think Canadians can engage in so many ways, including getting in touch with their MPs, obviously writing about this, talking about this, and as you're doing, exposing this issue to the media.
Well, thank you very much for joining us, sir, on Forum Daily.
Thank you.
Well, I'm Nathaniel Duick, and that'll do it for your look at top conversations from this past week. Thanks for joining us on Forum Daily's Week in Review, and we'll see you again next time. Have a great weekend.